Okay, so I'm gonna finish up this 3 video series with just mentioning that two of the pages that I really want you to look at from chapter 18 that I want you to really look at, understand, and it kind of will bring everything I think together from all the lectures and whatnot. We're going to be on page, and they're in kind of a graphic form, if you will, or like a colorful little form, which is on page 283 and page 284. Also, because I know this week, and I'm not quite sure if I mentioned this last week, but I had spoken to one of the clinical instructors who I know that we're synchronous, asynchronous, whatever. We're together as far as when sim and theory are. And for whatever reason, it didn't think about it as much because we're not together. So I did ask for the list so that I would make sure to spend a little bit more time, definitely starting next week. But I did attach a video to this week about leukemia. So you'd have a little bit more information, and you will notice I moved kind of everything to the top. So everything at the top is hematology, immunology, and then it's integ. So that hopefully that would just be a little bit easier to kind of go with. So hopefully watch it. It's a pretty good video. It's on the Khan Academy, and as well as you reading about it. But I had to choose, like, pick and choose, because I know I'm already way over what I'm supposed to be. And of course, I need to get ready for our HIV conversation tomorrow. And I'm hoping to prepare Jeopardy, because I think that will be a good way to learn it. And that will be something very important in our careers as nurses, that, to understand, and again, understand what we need to understand rather than every single little tiny detail. So we're going to just kind of finish this up with maybe like a 15 to 25-minute conversation. This is probably going to be the shortest video about allergies. So we will continue from here. So in chapter 19, I think that the allergies in themselves, and not that these are not important to grasp, but we all know how to read, and I do think that this is a more kind of tangible thing of knowing what's important. So there are different types of responses that our immune response will take, and I think, just to give you an example, we have hypersensitivity reactions to different things. Our immune system is going to react to different things to protect our body, and we have different things such as just, not just because it's not uncomfortable, it's not very comfortable, but allergic rhinitis is going to happen, where people are sneezing, and we have, unfortunate allergies. We know what anaphylaxis is, and we know that this can cause swelling of the throat, which is obviously very dangerous. And as I'm just looking through the book, I mean, we go from 1 to number 4, and all of that I want you just to kind of, briefly read and understand, and you'll see what I really think is important when it comes down to the I forget what it's called, that thing I give you before your test, the study guide. But what I really more wanted to lecture about, other than allergies, because I do think that that's more understood. Your body is not responding to something well, and it's basically fighting back and saying no and trying to get rid of it and whatnot. I really wanted to spend more time looking at page 307 at the autoimmune diseases, and from there. So that's what we're going to focus on for the next 15 minutes to 20 minutes or so. So that's kind of our agenda for this last kind of closing of this video series, if you will. So as far as autoimmune disorders, and remember, I'm going to say it again and again and again, what I feel I'm teaching you is something more of the big picture, go as deep as you would like within the textbook, but I really want you to remember and be able to grasp. So when I think of autoimmune, without even looking at the book, I know that means something is attacking my own body. And now, do I know every nitty gritty on my own without having to kind of relook at it and, oh, okay, yeah, okay, that makes sense? Of course not. I don't do this on the day to day, which is why I feel why it's so important to not get too overwhelmed with everything, because we have so much to remember as it is. Okay, so again, I said it. So we think autoimmune. And at this point, I'm on, actually, I have the book with me this time. I didn't take notes. So because this I feel more comfortable with. So this is on page 307. Autoimmune disorders, basically your body's cells inside of your body are not able to recognize the cells that are normal versus those that are not normal. And as we learned from the previous discussion from chapter 18, that's very important to know. When do we have an antibody? When do we have an antigen? When do we attack? When do we not attack? And at this point, we're not able to do that. Instead of instead of antigens on the body cells being recognized as something that is not supposed to be there, your body's not able to do that, which obviously is going to be a problem. So this is when we need to really realize, okay, what autoimmune disorder, okay, number one, I think that's the most important thing. If you remember that over nothing else, I think that's really important. If you can remember some of the most prominent things that fall under that category, I think would be great. And again, I will have a study guide for you. But looking at several factors, either because of influence or breakdown of the recognition of yourself, not being able to recognize those cells, and nothing that you've done, obviously on purpose or done to yourself. And there can be a variation of differences of why this happens. An example, which you may or may not want to remember because it could be important later on, will be hormones. That could be an influence of why this breakdown of the self-recognition could happen. That's just one example. And I like that example because maybe if you had a perimenopausal patient that had some symptoms, maybe that might be a red flag in your head and think, oh, well, maybe this could be something. And then you could have some input into the conversation. So moving forward, some autoimmune disorders really, they're discussed all over the chapter. I mean, they're everywhere. There's so many charts. There's just so much information. It's almost overwhelming for me. And I feel that I am pretty knowledgeable as far as, whether I'm a psych nurse or a med-surg nurse or whatever type of nurse. I understand things easy. I remember things when I see them. It is an overwhelming chapter. So please, if you feel that way, I don't want you to hopefully feel like you are just, oh my goodness, I'm never going to get this. I'm not doing well. I don't want you to feel like that. So please bear with me as we go through this together. And this is why I'm doing so many short videos, because I feel like it's just working better and I've gotten some feedback on it. So we're doing the best we can. Okay, so we're going to start with pernicious anemia. And that is something that maybe, I know anemia is definitely a word that we've all heard before. And anemia is basically where you lack the oxygen on the red blood cells, right? And usually it causes symptoms such as lethargy. Many women experience this during menses because they're losing such a large amount of blood. But this is a different type of anemia where things are being attacked. And that's why you don't have enough red blood cells. And you need this. You need that. You need this in order to have enough oxygen in the body. So just in very quick, the pathophysiology is right here, but it's your immune system is targeting basically its own self, and it's making antibodies which are destroying these particular cells that we need in order to be able to have our body function correctly with our red blood cells. That is the short of it, and what is really important to remember. Again, nitty-gritty, read it, and then you'll get the nitty-gritty. But that is the basic overall overlook of what it is. Some signs and symptoms, of course, are important as a nurse to kind of be able to help recognize if this could potentially be an issue for your patient. And like I just said earlier, with lethargy, weakness, some loss of appetite, potentially some inflammation of the tongue. That's actually one that is, I would say, at least in my own experience, it kind of puts, I apologize, you guys know I'm not very good with my pronunciation, but my pernicious anemia, set apart from other types of disorders, is that tongue inflammation. That is something that you will tend to see that sets it apart from other things. Of course, irritability, pallor, confusion. Those could be so many different things, but that thick tongue and that, or infection of the tongue, if you will, inflammation, just that big tongue is going to be something that is very prominent, if you will. You can read the diagnostic tests. I'm not as in my personal class, I'm not as interested in the tests. I want you to be more equipped on being able to recognize something, and you can read about the test, and I feel confident that you can read about the test and understand that. I want to hit upon more of the autoimmune diseases and give you little factors here and there, so, and why they're important to understand. So then our next one is going to be it's also anemia, but it's idiopathic autoimmune hemolytic anemia, which in this disorder, it's a little bit different. So in order to explain it, I'm trying to think of an example. So you're producing your red blood cells, and basically they're clumping together and then destroying them. And when you have red blood cells that are not circulating throughout the body, what do you think is going to happen? Obviously, your tissues are not going to be getting enough red blood or oxygen, so that is not good in many reasons, obviously, because we know that we need oxygen throughout the body. It's very important. And in order for us to function properly, feel good, and then we will seek treatment, hopefully at that point, and then we can, go from there. The next one would be Hashimoto's thyroiditis. I believe you've already talked about this, and we're going to talk about, I'm not going to spend as much time on this one only because we're going to talk about it in endocrine. So I don't need to skip over things, but this is more about endocrine. So I am going to kind of skip over it, but it basically has to do with your auto antibodies from your thyroid stimulating. It's like this whole cascade, and that's what the endocrine system is a lot about. So we will talk more about that then. Might as well save a little for then, right? Because there's a lot right now. Systemic lupus. Lupus is another one that I'm sure most of you have heard of. And there are different types of lupus that can happen in adults. And I'd like you to read over that on page 309. So just read over that, what lupus is. And, they do call it in general, and then this makes it confusing for several people because they call it SLE, because it's systemic lupus. And then of course I can't say that word, but they call it SLE, and it is an autoimmune disorder. And usually it's shown by exacerbations and things come up, and it's where the body develops antibodies that are not normal, and it's working against your own tissue. And this can lead to an unfortunate misleading to information of the immune complexes. So, I mean, connective tissue is a big part of it. And when this is activated as a result of the whole system in itself, you're getting a negative autoimmune system, which will affect, like I said, the healthy connective tissue. So if you can remember SLE and connective tissue and having a problem with that, and that meaning that it is systemic lupus, that would be important. And the result of that immune complex having to do with blood and other organs, leading to inflammation, damage, and possible death. That, again, this is how I want you to remember things. Not because, again, that the little things aren't important, but I want you to get the big picture of what is happening with these patients. And you can read the rest. You have the book. That's why you paid for the book. That's why you paid so much for the book. And unfortunately, we did not get through what we wanted to get through because there was so much. I'm not even going to go over page 313. It's so rare. I've never seen it in my life when I've been working with patients. I have posted the video on leukemia from Khan Academy, which is amazing. The only other thing is on page 314, and it has to do with immune deficiencies, and we're going to talk more about that, of course, tomorrow when we talk about HIV with immune deficiencies when they occur in several different ways. But they do talk about this disorder on page 314 again, which I've never heard of. So I don't feel I want to go over that. Now, should you read it? Yes, please do. But I think I said enough of what I wanted to say and what I thought what I think is important for you to grasp. And again, that's a big picture. This equals this equals this and involves this. And that's what I would like you to get from it. And then tomorrow, luckily, it's just one chapter, and I feel much more comfortable with that. And it's a very important chapter on HIV and AIDS, which I think all of you need to be extremely familiar with. When I say extreme, I mean familiar with enough where you can have a conversation and maybe not be able to answer all the questions, but be able to be equipped to feel confident to answer the questions, because this does come up a lot. I see several of my patients that do have HIV, not just because that they're drug users or this or that. A lot of people in the world, HIV is not as not around as people, I believe, in my opinion, think that it may be. So, okay, I got through that part. This is the last part of this series. Tomorrow we'll start over with chapter 20, and then I will post the quiz. I know you guys have a quiz on Friday, so you guys will have the quiz. Quiz is only going to be on HIV. And again, because I think HIV is extremely important as far as patient teaching and all of that good stuff. And I will, based off of if I do Jeopardy or Quizlet or however I do it, it's going to result in what I talk about on my video tomorrow when I do class, and whatever activity I do, and whatever is in your workbook, and what is in your workbook, in the back of your workbook, in your book, what I mention, and in the back of your book, like questions from chapter 20. Just want to make that clear again. I think you guys got that by now, but just want to make sure everybody does get that. And I'm going to go ahead and end this now so that I can post it. And I hope you guys all had some sort of a relaxing day. It has been a heck of a week for all of you. And I'm here if you need me. And I look forward to seeing you in the morning. Not good night, but goodbye.